Hello everybody and welcome back to this week's episode of Medisodes. I'm here with Shrey, Adrian and Surya, and this week we're going to be talking about how to become a doctor in the UK. Now I'm sure for some of you, becoming a doctor can be a very daunting task and very complicated, but don't worry, we're going to break it down very simply. And of course, it starts with being a med student. Being a med student is degree level study. And for most people, this means once they become 18, they go to a university of their choice to complete a medical degree, either MBBS or MBCHB. There's 35 med schools in the UK, and almost all of them offer degree level study alongside postgraduate study. So for a lot of people, it's not always necessary to go into med school straight after sixth form or whatever sixth form college you're studying in. It can also be a postgraduate course. For example, dentists can actually become full-fledged doctors doing a PG course at certain universities. So most courses will be around 5 to 6 years. That extra year, the sixth year, is usually an intercalated BSc or even a master's. And in some really special cases, they even let you do a PhD. This sort of flexibility is an example of med students being quite high-achieving students, even compared to other university students. And this is required training for any doctor in the UK. So you have to go through med school at one of those 35 approved schools. So this is all managed by the Medical Schools Council, the MSc, and they have a close partnership with the GMC, the General Medical Council, and they help you get approved to become an actual doctor. Of course, they also accept international students, and so international equivalents of the medical degrees you get in the UK are also accepted, although you have to do an extra test to get licensed in the UK. So most medical schools go through a pretty standard process of teaching. Oxford and Cambridge are quite special because they don't let you do any clinical work in the first 2 to 3 years. However, most medical schools will get you in hospitals or GPs from day one, basically, to get you that practical experience. And over the course of your time there, you're going to be learning about pharmacology, surgery, and all the fun, complicated stuff of becoming a doctor. And at the end, you have to take 2 very important tests. One called the situational judgment test. Now, not to be confused with the one in the entrance test, the UCAT. This is a multiple choice test, and it's for all around doctor skills, basically. And you also need to take the prescribing safety assessment. So this is specific to your prescription of drugs, and it's a pass-fail test, but you need to pass both to enter the next stage of foundation training. Now, from 2024 to 25, they're actually introducing a new test for all medical schools, and this will be integrated within the course itself, called the Medical Licensing Agreement. This will be a 2-stage test with the Applied Knowledge Test, or AKT, and a CPSA, or Clinical and Professional Skills Assessment. The first part, the AKT, will be another on-screen multiple choice exam, whereas the second part, the CPSA, will be a practical test. Again, pass-fail. Again, it's to make sure you have the skills required to become a full-fledged doctor. So being a med student is really mostly like being any other university student. You're obviously not going to get paid, but you are studying within normal university hours. During your placements, that might change depending on the shifts you get, but for the most part, your personal life won't be affected too badly. So what do you guys think about med students?
I think the main thing, especially in the UK, is it's very competitive to get into med school. You either have to do BMAT or UCAT, and you also need to get pretty good A-level results to get in. Sometimes that can be very stressful for people who are like 16, 17, 18, like trying to get those results.
Yeah, definitely. I think once you become a med student, however, of course, it's very challenging, but because you've kind of proven yourself to be a high achieving student, you should be okay to go through these 5-6 years. And of course, all the colleges are really good at handling teaching at that level.
And for those listeners who are interested, the new test, does that affect people who are going to finish med schools in 2024 or going to start in 2024?
I think it's going to be introduced in 2024. So if you're currently in med school now, but you're going to be graduating in 2024/2025, that will come into effect with you.
Okay. And what do you think about the interview process?
Well, I think the interview process, obviously it's different for every med school, and again, quite competitive depending on the med schools you're going to. but I think it's a good way of assessing a candidate's criteria. I think med students have it pretty easy in terms of learning and working within the NHS. I think it's quite interesting, the relationship the NHS has with universities in the UK. So, for example, placements in university hospitals, what do you guys think about those? Do you think it's good that the NHS has such a good tie with universities?
I think most students are going to end up working in the NHS. I mean, just by default, that most job roles in the UK for doctors are in the NHS. So yeah, it's better to have that, especially the practical experience, not just learning out of a book. If you get to see patients, that can only be a good thing and help you become a better doctor.
And so after med school comes your foundation training. So Surya, do you want to tell us more about that?
So after finishing medical school, the medical student will be qualified as a doctor and will proceed into 2 years of foundation training. Doctors will complete this foundation training in foundation school, and the foundation years are split into 2 years, foundation year 1 and foundation year 2. In order to complete the first foundation year, doctors must show that they've met all the things in the outcomes for provisionally registered doctors, which includes things such as maintaining good medical practice, relationship with patients, and working with colleagues, and similar characteristics. Once your foundation school thinks you have met these certain competencies, a certificate of experience will be issued by the foundation school to the GMC, which is the General Medical Council. Then doctors can then use this to register for a license, allowing them to practice. Then they can go on to do foundation year 2. And in these 2 foundation years, doctors will be putting their undergraduate medical knowledge into practice in a variety of different placements, which cover different specialities. There will be 6 placements across the 2 foundation years, and each of these placements will last approximately 4 months. The foundation training program is designed for newly qualified doctors to get an overall understanding of the different specialities in medicine. Being exposed to a wide variety of specialties allows the doctors to find their specific passions in which they can then specialize in later on. There will be a variety of programs and placements to choose from. Doctors will be asked to rank their preferences of programs, but whether they get the preferred placements depends on the score from the medical school, which includes the score that you get in your situational judgment test, as Anupam mentioned earlier. And some of the placements that you could choose from include A&E, general practice, obs and gyn, which is obstetrics and gynecology, and pediatrics, as well as a lot more. So there really is a large range of specialities and clinical settings to explore. So these foundation years will provide doctors with vast amounts of practical experience after medical school and will enable them to develop teamwork skills, communication, and other essential skills required to be a good doctor. Doctors in their foundation years will also have to balance these placements along with learning, because there will be 3 hours of timetabled learning per week, and this just reinforces how lifelong learning is such a crucial aspect of medicine. So the different rotations require different roles. So this might be attending ward rounds, or looking after patients, or talking to the patient's relatives in order to inform them about what's going on with the patient. So if I was to sum up what the foundation years are, they're basically 2 years where doctors have a brief look at the different areas of medicine, expand their experiences, and get to truly find their passion. What do you guys think about the 2 foundation years?
So would you say that the foundation years have a pretty strong effect on where you go next in your medical career?
On your 2 years of foundation, you'd probably find something that really interests you, whether that be GP or A&E. But there's really a wide range of choices of specialities to choose from. And if you find something that really interests you, that can really have a profound influence on what you can specialize in, because this is the first time you're experiencing different specialities after medical school.
I also think so in foundation years you got 2 rotations of medicine or surgery, and the other one is whichever one is the alternative. So I think the foundation years, finding out whether you want to do general medicine or surgery is really important, because that will completely change where your career goes.
So the alternative one that you mentioned was a community medicine, which is like GPs and psychiatry, which is basically like community medicine in the sense that you get to form really close relationships with like patients in the local community, and you see them over a long period of time, so you get to build a good rapport with them essentially. So if you like that kind of closer patient doctor relationship, I think community medicine might be useful.
I think the foundation years are similar to how work experience is influential in helping you choose your career, because it allows you to choose what specialty you go through. And medicine's got such a wide range of specialties that it's not just doctor, is the multiple different roles that you have as being a doctor. And foundation years are crucial in letting you choose what you want to be and how you can become that. So I think that's one of the most important sections of your career.
Yeah, I definitely agree. And of course, though, with it being so important in your career, I'm sure it's going to be a lot more demanding than maybe med school would have been in terms of your hours and work times. So I guess that's kind of the trade-off you get for more seniority.
And after you finish your 2 years of foundation, you'll go into specialty training. There are many different pathways which Adrian is going to talk about.
So after foundation training, a doctor will go through specialty training. Once a doctor satisfies all the requirements of a GMC approved training program, they're awarded a certificate of completion of training, otherwise known as CCT. The CCT is used to then join the GMC Specialist Register to be recognized as consultant. Postgraduate training in the UK to become consultant does not involve degrees such as a master's or a PhD. These are optional. Official training programs to become a consultant take place in the NHS, and there are no training programs in private hospitals or at universities. So as a doctor, you will definitely work in the NHS throughout your career. There are two types of training program, uncoupled or run-through. In uncoupled specialty training programs, the specialty program is split into two stages, core training and higher specialty training. Core training can be 2 or 3 years in length, depending on the specialty. The first year of core training is called CT1, the second CT2, and the third CT3. After completing core training, doctors will then need to apply for higher specialty training. Higher specialty training starts at ST3 if the core training was 2 years, or ST4 if the core training was 3 years. Every year, the numeric designation increases until training is complete. The other type of specialty is run-through. In run-through training, doctors apply for the first year of the program, which is called ST1 for Specialty Training 1. There is no further application process after this, and specialty training is the only stage of run-through training. In the UK, doctors train as they work, so there is no tuition fee for training, and they are paid a salary as a working doctor too. Postgraduate specialty training in the UK is not a university degree, and universities have no role in training programs. Though there are no tuition fees as such, there are still professional fees such as GMC registration and medical indemnity. Training jobs in the UK will involve multiple rotations at different hospitals. The length of these rotations can vary from 6 to 24 months, but the usual is a year. Some specialties tell doctors what rotations they will be doing throughout training, whilst others will only inform them 2 months in advance, with no opportunity to state their preferences. Most rotations are in a small geographical region, so doctors can live in the same house while training. However, some regions, especially rural areas, are very large and hospitals are spread over a large area, so doctors will have to move house every year so that they can commute to their hospital of rotation all the time. Though this is extremely disruptive, it provides fantastic opportunities to work with and learn from a variety of patients and mentors. Each specialty has their own postgraduate qualification, and the qualification is achieved by passing the relevant exams. There are multiple exams for each qualification. These exams are known as membership exams because once the doctor passes them, they become a member of the relevant Royal College. Specialty trainees need to pass all their exams during training, not after. In uncoupled specialty training, junior doctors need to pass a set of exams before you move on to higher specialty training. In run-through specialty training, doctors need to pass at least one exam before passing from initial years of training to their higher years. However, in all other specialties, doctors have to pass all exams before progressing. For all specialties, doctors need to pass all parts of all exams before the end of training in order to be awarded the CCT. They cannot wait until after training to sit their exams. However, if you pass an exam early, it does not mean that training can be skipped. For example, a core year in surgical training cannot be skipped just because the doctor has passed the MRCS exam. There are several specialties in medicine that a doctor can choose to specialize in, and this decision can be a tough decision for a doctor to make. There are currently more than 60 different medical specialties available in the NHS, and they can be classed under 3 broad categories. The first category is medical specialties, which covers many of the conditions for which people are admitted to hospital. They are concerned with the practice of the diagnosis, treatment, and the prevention of disease. For example, medical oncology is a specialty that is solely concerned with the treatment of cancer, and there's a great deal of contact with the patient and family. Another example is palliative medicine, which supports the patients with life-threatening advanced progressive illnesses that can't be cured with conventional medicine. Doctors working in palliative medicine help manage a patient's symptoms and provide psychological, social, and spiritual support. The next category is surgical specialties, which, as the name suggests, is about operating on particular parts of the body to address special illnesses. One category in surgery is cardiothoracic surgery, which deals with the diagnosis and management of surgical conditions of the heart, lungs, and esophagus. The final category is grouped as other specialties. One specialty that falls into this category is emergency medicine, where doctors specializing here are generalists, but they specialize in resuscitation too. A number of doctors also develop their own subspecialty interests, such as trauma. This is a specialty that attracts those who can make immediate decisions. Pathology also falls in the category of other specialties, and it is about the detection of disease through a variety of investigative techniques, such as blood tests and biopsy. It has an important role in identifying the source of a disease and reducing the risk of further spread. So I've given you some examples of the different types of specialties that you can go through, and there is definitely a rigorous training program to ensure that you're fully competent before progressing. So what do you guys think about specialty training?
Well, I think that the real advantage of the specialization phase is that doctors can really take a break to focus on different aspects of their life as well, such as family commitments, like starting a family, or follow their passion in research, or like they can also volunteer abroad if they wanted to. So I think there's a really great chance to like diversify your career in the specialization phase.
Yeah, I agree with that, especially since doctors aren't doing a broad range of different areas of medicine. They're focusing on the areas that they've chosen. So that will make the job definitely more enjoyable for them as well.
And as with anything, specialization means that the doctors, like, instead of having to see a couple of things just once in a while, you can tell like you'll be seeing similar things every day, which will mean you're more effective and because you've got more experience in those specific problems.
And I think it's very important that there's such a range of opportunities as well, because medicine isn't the same across the whole country. So working in like a big inner city hospitals, really different to being a GP in some small village. And so I think specialization training really helps doctors to be better at their specific framework of medicine.
And now I'll hand over to Shrey, who'll be talking about what happens after specialty training.
Thank you. So after you finished your specialty training and you've done the relevant exams, depending on which specialty training you've done, you can go into a number of different careers as a senior doctor. So many go and become a consultant, which the consultant is the head of the care unit at a hospital, and the buck stops with them. They are responsible for that whole department, and they are the top dog. And that comes with responsibility and also privileges. So as a consultant, you don't just have to have be in clinics all the time. You can also have experience in management. You can go into research. You can go into many different fields. It's not just clinical. So if you don't want to just do clinics, there's other things you can do. It's a really there's lots of variety in being a consultant. And second one is an SAS doctor, and these people work across different healthcare settings, and especially in the community, treating different health conditions. The third is an academic doctor. So here you'll be conducting research in labs, in maybe collecting data, which is really big at the moment, analyzing data. If you're an academic doctor, you probably want to do an MD or a PhD. So that can be done. You can do it just after medical school, or you can do it after foundation training. You can do it after specialty training. So that's you'll do a research project. And actually, during the foundation training, you can do an academic foundation year as one of your rotations. So if you want to do that, you might be interested in pursuing applying for that. And then separately, so GP training, unlike the others, takes 3 years rather than 8. So you're becoming a senior doctor much earlier. And a GP is like a family doctor. You're based in a practice, and you're looking after a certain list. You have lists of patients, and you're looking after them. You're seeing a huge variety of cases. So you could be seeing anything from a person with heart disease to someone who has cancer to someone who has maybe congenital disease. And it's a wide variety of cases, and you then have to see which is the best healthcare option for that patient. And as Adrian has said, you really develop a close bond with your patient. For some people, that suits them, that they can see people, they're seeing the same people over and over again. Some people might not like that. Is personal preference. Yeah, a GP is a really good option. And 50% of those who finish the foundation year will become a GP. So it's a massive field to go into. But there are also many different types of GP. You can be a locum, which means you're basically filling different jobs at other practices on like kind of a session by session basis. Or you could be a partner in a practice. So a GP practice is structured like a small business. You're referring patients to different hospitals, and then you're paying the hospitals. And you can become a partner in a GP surgery and managing that. Some might find that interesting to do. You could also become an academic GP. So similar to the academic doctor, you're going to be looking at research in different public health or different things in the population. If you want to go into research, go into academics, you can still do that as a GP. What do you guys, as senior doctors, what do you guys think about the role that they have within the NHS?
So they definitely have a lot of responsibility now that they've had all this training. And so what do you think is probably the most important of these different types of senior doctors?
I mean, they're all important in different ways. I mean, the GP has a key role in primary care because they're the first port of call for patients. And before you can see any of the other people, you have to go through your GP. Consultants have the most responsibility within a hospital setting, and they are the people who are making the decisions about patients. And then academic doctors also have a key role because their research can lead to new treatments, new ways of treating illnesses that can improve patient outcomes. So as a senior doctor, you can really have a huge influence, whichever type of senior doctor you are.
Yeah, and I'd just like to stress one of the important things about a GP. So GPs are crucial in prevention of diseases because they are the ones who give information to the public who might not know what they're doing to risk their health. And prevention is better than any treatment. And for every pound that the NHS spends in prevention, they save £14 in treatment. And of course, the NHS, like any organisation, is constricted by budget. So I think a GP has a crucial role in making sure that people remain healthy.
Yeah, I
Yes,
definitely agree with that information about GPs. They definitely play a critical role. And it's kind of a shame that right now in the NHS, GPs have come under heavy fire from budget cuts in the government because, like you were saying, prevention is better than the cure in most cases.
Yeah, I think we've seen that especially with smoking and obesity, which are huge, massive problems. And they cost the NHS a huge amount of money. So if we can stop people smoking and making people have healthier diets, it means the NHS can spend more money on beds, more money on hiring more doctors, and providing better care for patients, which will obviously help all of us.
So what do you guys think of as a whole, the whole process of becoming a doctor? Do you think it's too long? Do you think it's too difficult? What do you guys think?
I think medicine is not a career for the faint-hearted. As a medic, you're going to see death, you're going to see people suffering. Not all the patients you're gonna treat are going to make it through, and that can be really hard on people's mental health. And you have to be really strong as a doctor. You have to be really mentally strong and also very hardworking, especially through medical school. You still need to put in a lot of hours of study, and you need to get on top of that. And I wouldn't. I think medicine, people see it as a very high status job, but I don't think you can be in medicine for the money, because if you want to make money, frankly, become an investment banker. If you want to help people, if you don't mind working hard, I think medicine's a really good option for you.
Any other thoughts, guys?
I think that becoming a doctor requires you to hone a lot of important skills such as communication, and I think that it can take time for you to develop these skills. So I think that even though it is long and you need a lot of resilience to make it through the whole of your medical career, it's still necessary for you to perfect your skills and to become a better doctor, I guess.
Yeah, I think like Surya's saying, it will be a long time. If you compare it to other university courses or other jobs in general, you're still probably going to be studying well into your early 30s, whereas most people already be advancing up the ranks in their jobs. But of course, medicine is so more demanding because it's people's lives you're treating. And so I think it is necessary, this sort of long process. And it's also important to have a lot of friends as well, not just within medicine to help who understand the process you're all going through, but also outside of it to take you out of this bubble that doctors can sometimes end up in.
Yeah, and I think hopefully we've shown today that there's still a huge variety within medicine. People might have the impression that being a doctor is a certain thing, but you can be what you want to be within medicine, and whether you want to do research, whether you want to be in primary care, there's a huge variety. So no two doctors' jobs are exactly the same.
And so I think we have covered the career path of a doctor in the UK. Thank you guys for listening, and tune in next week when we'll have another Medisodes episode. Remember to like and subscribe. We really do appreciate it. And thank you for listening.